just wanted to wish you all a happy, very nice summer. And so this is a series of webinars that we conduct. So I want to introduce you to a special guest. Her name is Catherine Toms. Dr. Catherine Toms is a public health physician. Before leading Green Cards for Kids, Catherine was a senior advisor for climate and health for the international nonprofit Healthcare Without Harm, as a steering committee member with the Florida Clinicians for Climate Action. She educates other health professionals and the public about the health impacts of climate change and advocates for equitable solutions, promoting clean energy and resilient communities. Dr. Catherine has been working with Green Cards for Kids for a while. She just had a launch in Broward County here in Florida last month, and I'm just so excited to hear about this project, this initiative. She's very passionate about it. Catherine and I presented last year at the IHI Forum in Orlando. So I'm very excited to listen to what she has to say. So Catherine, you're on.
Great. Let me just share my screen. There you go. So how does that look, guys? Look okay?
Looks great.
Okay, so thanks for the introduction, Liz. It has been such a pleasure getting to know you, and I just want to thank Annie for inviting me. I have to say, you're a great organization, and some of my closest colleagues that I work with in the climate and health space are members of Annie. And usually when I find a real advocate, I find out they're also members of the Alliance of Nurses for a Healthy Environment. So it's really great to be here with you all. I'm not sure where to start, but I just want to, I hope this conversation is inspiring to you all, because the work we do can get pretty heavy. And I know you all have very busy schedules and very busy lives, and the time you take out to address climate impacts is valuable to your family, my family, and the future. So thank you. So building local solutions to tough challenges that can have profound impacts on lives of the people we serve is a quality that all health professionals have. But I believe it's innate in all of us. It's just part of human evolution. And I hope the story of Green Cards for Kids inspires you to not only support and partner with us, but also to continue what you already do so well. So that's bridging silos, collaborating, finding solutions that improve public health, and especially perinatal health, which we're going to really focus on in this conversation. Let's see. So you all know this quote: the Lancet Countdown on Health and Climate Change calls the climate crisis the biggest global health threat of the 21st century. But then they came back a few years later and said, wow, this is not just a threat. This is an amazing opportunity to improve public health. And there are a lot of opportunities. So these are just the learning objectives of today's webinar. Describe the current state of perinatal health in the U.S., identify 2 examples of racial inequities that lead to disparities in perinatal health, at least, and be able to summarize what we do at Green Cards for Kids. So the first time that I connected the dots and started thinking about the impact of climate change and on our health was as a medical resident. So a migrant worker was admitted to labor and delivery in premature labor. And she had been working in the fields on an unusually hot spring day. My patient was warm to the touch, had flushed skin, and was sweating profusely. So we know those are signs of heat exhaustion. And she gave birth to a baby girl, somewhat small for her age, but otherwise healthy. The mother and baby did well, and after a couple of days in the NICU, the baby was able to go home to her family. But I just couldn't stop thinking that the heat had played a role in my patient's premature labor. So we all know that women and babies in the US don't fare as well as my patient did. Childbirth in America is risky for moms as well as infants. And according to a report published this year in the Commonwealth Fund, by the Commonwealth Fund, American women have the highest maternal mortality rates compared to similar high-income nations. And we know that Black women are 3 times more likely to die due to pregnancy complications than white women. When it comes to infant mortality, those rates are about, our infant mortality rate in 2020 was 5.4 deaths per 1,000 live births, and the average rate in those OECD countries that were similar to was 3.9 deaths per 1,000 live births. So we're not doing well for maternal or infant health. Let's see, just a second. So maternal and child health in Florida mirrors that of the nation. It's very similar. The preterm birth rate in Florida, which is where Liz and I live in South Florida. So I'm going to focus a little on that, but this has general applications. So our preterm birth rate is nearly 11%, and the March of Dimes gave Florida a grade of D+. And according to the March of Dimes report, the preterm birth rate or grade for Broward and Miami-Dade was 11.5% and 9.7% respectively. So 11.5 for Broward and 9.7 for Miami-Dade. Broward earned an F and Miami-Dade earned a C. So we know that preterm birth and low birth weight are 2 of the leading causes of infant death in the US. And in 2020, 1,217 infants died in Florida. And these statistics, as you all probably have heard, are rising in recent years. So a lot of work needs to be done to tackle this. So one of the questions that I thought about was, even though we have the most sophisticated and expensive health system in the world, why are our outcomes so poor? So there are lots of reasons for poor birth outcomes, but we need to understand these risk factors so that we can develop effective solutions to improve maternal and child health. And one of those reasons is a lack of comprehensive prenatal care. And according to HHS, babies of mothers who don't get prenatal care are 3 times more likely to have low birth weight and 5 times more likely to die than those born to moms who do get care. One in 3 births in Florida received inadequate prenatal care. So this is something I think, and you all too, would say we can really work on this. This is something we can improve. And we also know that low-income women in America are eligible for complete prenatal health care coverage through Medicaid. As soon as they know that they're pregnant, they can apply for Medicaid. So you all probably, like me, have asked the question, why aren't women getting the prenatal care that they need and deserve? If they can if they're not able to afford health insurance, then they can apply for Medicaid. So I delved a little deeper into this, and it comes down often to social determinants of health. And research shows us that 40% of our health and well-being is the result of these positive or negative factors. And then studies show that lack of transportation is a considerable barrier, both here in South Florida and nationally. And regardless of health insurance, 4% of patients, including 3 million children, miss a health care visit each year due to unavailable transportation. And that includes 9% of children in families with an annual income of less than $50,000. So it is a poverty issue. According to the 2018 Community Health Needs Assessment that our children's hospital in one of our children's hospitals here in South Florida, Nicholas Children's Health System, published, over 73,000 children in Miami-Dade County and almost 47,000 in Broward face barriers to healthcare because of lack of transportation. So I realized that this is something we could work on to improve prenatal care. So you all have probably heard of this landmark study, which, when you think back about my earlier patient, it does confirm that heat has an impact on prenatal health. So this landmark study of over 32 million US births was published by Bruce Bakar and his colleagues in 2020. And they found that women exposed to high temperatures or air pollution during pregnancy are more likely to have premature, underweight, or stillborn babies. And their results also showed that not all women were impacted equally. Once again, Black women and women with asthma were even more affected. Air pollution and extreme heat will continue to get worse if we don't make a collective effort to reduce our fossil fuels, oil, gas, and coal. So we are seeing warmer, wetter weather as our atmosphere traps CO2 and other greenhouse gases, and you all are very well informed on this. And in fact, the last 6 years have been the hottest ever, 8 years have been the hottest ever recorded. NOAA reports that 2022 tied with 2015 as the 6th warmest year on record. I think NASA has it as the 5th warmest year on record. I think they use a little different statistics. So each decade since 1980 is hotter than the previous one, and meteorologists predict even hotter temperatures in the coming decades. So let's take a look at air pollution, the other impact on pregnant women. And according to the American Lung Association 2023 State of the Air Report, cities stretching from Fairbanks to Augusta, Georgia, are polluted with unacceptable levels of greenhouse gases, ozone, and particulate matter in particular. California cities are especially burdened, this list shows. So more than 1 in 3 Americans live in places with unhealthy levels of air pollution. That's about 120 million people that live in places with failing grades from this report. And once again, there are disparities. People of color are 3.7 times more likely than whites to live in a county with failing grades. So it's clear that we have to all work together to reduce our dependence on fossil fuels. But how do we do that? And what is the quickest, most effective way? So this is graph from the Congressional Budget Office that shows that the transportation sector accounts for the largest portion of CO2 emissions, almost 2/3 of which is from personal vehicles that we drive around. And the latest data from the U.S. Energy and Information Agency shows that 50% of Florida's total greenhouse gas emissions come from transportation. So we're even worse off in Florida when it comes to our cars emitting air pollution. So it's clear that if we can transition to electric vehicles with zero tailpipe emissions and clean 21st century electricity generated by the sun and other renewables, we can drastically reduce our carbon pollution, which would lead to cleaner air in the short term and will slow rising temperatures in the long term. So I'm just going to recap a little bit so that you know what Green Cars for Kids is addressing, and then I'll go on to explain the program. So the first challenge is that too many expectant moms and kids are missing out on healthcare that they need simply because they don't have a reliable way to get to their healthcare appointments. And the result is unhealthy pregnant women delivering children that often suffer from lifelong health consequences, and in worst cases, death for mom and baby. And this again has a devastating economic impact on that family, on society, and the health system in general. In fact, the U.S. health sector loses $150 billion annually in missed appointments. And the second challenge that we address is that we're dependent on fossil fuel powered cars to get around. The tailpipe emissions from our gasoline powered cars is making our air toxic and driving the warming of our world. So our program provides free transportation to non-emergency healthcare for under-resourced kids and expectant moms using an all-electric fleet. So this isn't rocket science, it's not complicated, and it's really not an original idea. So Kid One is founded on, Green Cars for Kids is founded on a program called Kid One, which is based in Birmingham, Alabama, and has been successfully serving Alabama's families for 26 plus years. They just had an anniversary. The only difference between the two programs really is that we use electric cars. And 26 years ago, there weren't a lot of electric cars. They also have a lot of rural patients, so they have a bit of range anxiety, but that's getting better with better electric cars. So Green Cars for Kids is a climate, health, and equity solution, and we aim to improve perinatal and pediatric health by increasing access to care, reducing air pollution, and decreasing greenhouse gas emissions that fuel the climate crisis that impacts frontline communities most. So we know that a lot of the busy roadways are in low-income communities. So these communities are doubly impacted with air pollution and the urban heat island effect as well. So because perinatal health and the climate crises don't allow time to reinvent the wheel, we are partnering with a Miami-based all-electric ride service, Freebie, to launch our pilot in Broward County. And we're focusing on 2 zip codes primarily. We've had to spread out a little bit because there's such need, but we're really focusing on low-income communities, the zip codes of 33311 and 13. we serve established patients from a high-risk prenatal clinic, a regular prenatal clinic, and we're already expanding to serve kids in the pediatric clinic. They're all located in the same building. So our shared goals are to improve health outcomes for new moms and kids in Broward County. And our pilot is generously funded by the March of Dimes, and we provide door-to-door rides in all electric cars. It's a Tesla Y model. We have access to an ADA compliant van that is a hybrid in case we need that. And it's completely free to the rider. We have an on-demand app that we hope to be using, but right now the scheduling is going through the concierge service at the clinic through the social worker that's scheduling their appointments. And so she's coordinating the rides. So our drivers, half of them are multilingual, speak Spanish and English, and we can measure the success of the program by tracking the number of rides that are requested and provided and seeing how long it takes to pick them up and drop them off. All this information is gathered from Freebie, and they share it with us every month at the end of the month. We also have surveys that we share with the passengers, with the riders, and we have a monthly quality improvement call with the scheduler and her supervisor. So Freebie also has, we're setting it up, a tablet in the back that will show videos, short video screens in 3 different languages, in English, in Spanish, and in Haitian Creole, because we have a very large Haitian Creole population. Many of the women we serve speak Creole. So these videos are from the March of Dimes library of videos, and they cover things like safe sleep, nutrition. We'll have one on heat health awareness, because that's a high priority area that I'm concerned with, and breastfeeding, and a whole slew of different options. I want to make sure I have enough time. So we're getting input from South Florida's children's hospitals and maternity clinics. We've been coordinating with the Healthy Start Coalition. And our board members for Green Cars for Kids are volunteers, and they include the founder of Kid One, Russell Jackson, who is a firefighter in Birmingham and just started driving kids to the appointments they were missing. And Russell has been really great in giving us good guidance and helping us troubleshoot. And another board member is Dory Larson, who is the EV program manager for the Southern Alliance for Clean Energy. You all may know them. They're otherwise known by their acronym SACE. And we also have a very supportive advisory board that consists of leaders in the South Florida Haitian community and the Black community, medical community, and a financial advisor too, which everybody needs. So we coordinate the prenatal, the rides to prenatal care to the clinics, and we're hoping to expand to NICUs so that parents are also able to get to the NICU and spend more time there, get more information, and more importantly, bond with their children. A lot after premature birth, often parents have trouble being able to make it to the NICU because they don't have reliable transportation. So that's a group we're aiming to serve in the very near future. So we work to identify the communities most at risk for premature birth and the impacts of climate change, and help to map out where we'll be going next. Or we're coordinating with different hospitals so that we meet the needs of their patients, but we make suggestions as to the areas we think are most important to address in Miami-Dade and Broward. Let's see, we will be applying for Medicaid non-emergency transportation reimbursement vouchers, but right now the program is solely funded by the March of Dimes. Let's see. So I just want to summarize that Green Cars for Kids improves health outcomes and health system revenue while reducing costs by bridging the transportation gap that prevents children and pregnant moms from accessing the essential healthcare services they need. And we will contribute to improving community health in the near term by reducing air pollution for every non-combustion engine that's taken off the road. We immediately improve the air quality, and in the long term by reducing greenhouse gas emissions. We are cross-sector collaboration, and we're pulling in more and more partners that I can tell you about later. Let's see. So if you're interested, we would really appreciate your help. And the most important thing you can do is just follow us on Instagram and talk about us. And if you would like to connect with us individually, that would be awesome. There's my contact information on that slide. You can, if you're interested in us coming to your community, it would be great if you could give us an estimate of the patients that you serve that are transportation disadvantaged at your clinic, and let us know about the community health needs in the neighborhoods that you serve. And you can also connect us with your Medicaid managed care plan administrators, so that we can coordinate services. And I would just really appreciate right now hearing your feedback and answering any questions that you may have. So I'm just gonna stop sharing so we can have a chat. Okay.
Thanks, Catherine. That was great. This is a great initiative, especially for our mothers who are, living in these heat islands and trying to figure out how to get to their appointments. I'm so glad you brought this to our attention, because we don't think about that, of being in the hospital setting. How are these mothers and kids getting to the hospital? So this is wonderful. There's something like this was started. And you have really been, a pillar here in South Florida, trying to get this going. And I'm so grateful to your service, and and I know that our hospital is starting to look into that. So I'm looking forward to working with Holtz and your team, moving forward. So
Yeah,
yeah.
Go ahead.
So does anyone have any questions or
Just a comment, well, and a question. Thank you for the wonderful talk. It's such a wonderful idea, and I'm interested to know about expanding this program to other areas, because as we know that there's a lot of more hospitals and clinic systems that are closing all over the country, making patients even more at risk. I believe there was a report out that said there's 631 hospitals at risk for closure at the beginning of this year. And so patients are going to have even more difficulty with access issues. And this is wonderful for kids and moms to be, but it's also going to be an issue for other patients as well to get the care that they need as well. So just curious if there's been any efforts to expand it, or insurance reimbursement, or how that might work in the future, just so we can get excited about that.
Yeah, so those are great points, and you really drive home an important issue about rural communities, and lots of information now, especially about prenatal care in rural communities and the whole birthing experience. So the one thing that I can say about that as far as rural communities, because there are quite a few, especially in farming communities here in South Florida, everybody thinks about Palm Beach County as being a wealthy community, but that's where most of our sugar in America is grown, in Palm Beach County along Lake Okeechobee. And those are very underserved communities. Belglade is the primary town. And so with increasing range, especially with Teslas, we will be able to reach those patients and get them to the care they need. There is a clinic there, but it's really very primary care oriented. So getting moms, especially high-risk moms, to specialty care is important. So my eye is on that community in Palm Beach County, but there are also on the West Coast, in the Everglades, there are communities that are really cut off, that we can get to better facilities, especially those high-risk moms. And then, when you Lisa, you touched on funding, and that is an issue. So for our pilot project, it's funded by one funder, but we need to expand, and we're really getting a lot of information from Kid One about how they've been able to do that for 26 years. So they have a combination of federal funding and those Medicaid reimbursement vouchers, because the vast majority of the people we serve are Medicaid recipients. So we will be doing that as soon as we can. We just want to make sure the pilot is up and running and showing good results. And there are other ways that I've thought that we could access funding, and that's through collaboration with automobile dealerships and manufacturers to really help bring electrification to underserved communities, both rural and low income in urban areas, because part of making that transition is being able to visualize it in your mind. And if you're seeing these electric cars in your own community, and you're seeing charging stations coming up in your own community, it's a possibility, and you talk about it and you inform yourself. So I see Green Cars for Kids as being a really important tool in the equitable transition to electrification, transportation electrification, so that the communities that have been most harmed by structural racism aren't left behind in this new phase in development, because we will transition to electric cars. So that's really important. Also collaborating with utilities. We've been in talks with our utility here on the East Coast, FP&L, about collaborating, especially on getting federal funding through the IIJA, the Bipartisan Infrastructure Law, for some of that charging installation. And also there are companies that are really involved in putting these charging stations in low-income communities that we'll be working with. I had a conversation with the Florida Clean Cities Coalition manager 2 weeks ago, and there is really a lot of opportunity for collaboration there. Always Foundations are great sources, and you know, just individual donations have helped us a lot in starting out. So those are what we're using. Did you mention something else, Lisa? Did I leave anything out?
Those are the 2 points basically, but to your last point about demonstrating electrification and electric vehicles in the community as a new normal or as something to come to those communities as well. I can imagine that patients accessing the electric vehicles for their appointments might be inspired to continue to use that, because it might be fun for them to ride in a Tesla or an electric vehicle as well, as sort of a sidebar, as opposed to, you know, a bus ride or something like that. No, it's a wonderful co-benefit, and I didn't realize, I think we're a little spoiled out here in California that we see so many electric vehicles all over the place, but really it hasn't made it everywhere yet. And communities really need to have the infrastructure as well, the charging stations and the access to be able to use those types of vehicles. So that's wonderful to get these charging stations in with a bigger system in mind, and then have that be for some of the lower income or more rural communities as well.
Yeah, you reminded me that the Department of Transportation, U.S. Department of Transportation, did a whole study on pregnant women and public transit systems, and they really went through all the barriers that pregnant women and children. I can send it to you all so you can share it. That pregnant women and children are faced with in just not only getting to healthcare, but getting to the grocery store and things like that, and how they really are disadvantaged because, as you know, it's really hard getting around when you're pregnant or you have a newborn with all the paraphernalia that you have to have. So it takes a lot longer. They're more likely to miss their bus and then have to stand outside, often unsheltered in the heat. So, or in the cold. And so this is a way to address that, because I am a fan of public transportation, especially with the electrification of buses. And we've got a great rail system down here called Brightline. But honestly, for these women, it's often not, even some of our better connections are really not beneficial for them, and they're putting their health at risk, especially right now with the heat wave that's going through South Florida and heat indexes over 105 degrees. It's quickly they can get into trouble health-wise.
I'm also wondering too, if there is any opportunity for funding for advancing these types of programs based on the new Biden-Harris it was announced this week, the new investments to improve, measure, monitor, reporting, and verification of greenhouse gas emissions through that agenda. I know it's a little bit shifted, but it might be applicable, because wasn't it something like $20 billion? It's a lot of money. So hopefully there'll be more opportunities for supporting the work like this, and electrification and healthcare benefits as well.
Well, you just reminded me of a whole nother chapter of Green Cars for Kids that I didn't even mention, and that is the ability to do research. So a colleague of ours, Eugene Fu, is an anesthesiologist, and he is really interested in exactly that, and measuring air quality, but also heat very locally, and then comparing that to birth outcomes and following these patients and comparing the ones who get our service as opposed to the ones who take regular transit. But also one of the colleagues, I have to say, it's really wonderful partnering with a company like Freebie, because they have already discussed doing research, having an air quality monitor on their car so that they don't have any kind of confounding factors, and can measure air quality as they're moving through these neighborhoods, taking patients to and from their healthcare. So that is another way that we can get some data together to share with other communities. And one thing in California, there have been a few pilots of ride sharing. So I know there was one in a farming community that really was cut off, where they were able, I think they had a couple of electric cars and some charging stations. And as long as they had a valid driver's license and insurance, they were allowed to take the car and when they needed it, just sign up for it. So these are really creative ways that you can address this transportation gap, especially in rural areas. And when I remember what you said, Lisa, about other populations. Yes, and that is definitely something. When you other applications of this, and older populations, elderly patients, and patients that have mobility issues, this is a way that we can expand. It's my focus is maternal and child health, and I feel like introducing this program from that perspective can be more constructive, but also expanding it so that they have access to quality grocery stores or parks or childcare even. We've discussed that with Freebie. So, and they're already partnering with their municipalities here in South Florida to get people who are in food deserts, who live out in farming communities like Homestead, like Belglade, that don't have good grocery stores, strangely, in a farming community, to get to some affordable grocery stores. So lots of, I love hearing these ideas, because I feel like this is just the tip of the iceberg in ways we can address the environmental health, but human health. So
Absolutely. It's exciting. I have a question and a comment. I'm wondering too, if there's an opportunity to provide, if the patient or ride requester can, be in the back seat, participate in education, health education videos during their ride. That might also be another opportunity, a moment that they can get education, get quality education while they're going to and from their appointment, that you might otherwise not be able to do if you were driving yourself or in a different type of ride share. And then the question was, how do you have an average of the length of ride? Like, what's the average length of ride?
yeah, so we wanted to, in the pilot, keep it to around 20 minutes. We have some high-risk patients that are in Pompano, so that ride is a little longer, and so we have to compensate for that. But yeah, about 20 minutes. And what was the other question you said? The first
Oh,
one?
that was it. Just about an opportunity to provide education during the ride, which might be, kind of fun. I've, in some of the taxis here, there's a video screen in the back that you can watch, and it could be an opportunity to partner with a different research project where patients could have a menu of education to select from while they're on the ride, and watch that afterwards. So
Exactly. So we're working with Freebie. They're trying to figure out a way to make it safely fastened to the back of the car. That's kind of the only thing, but they've agreed to have a tablet in the back. And the way we're hoping to do it is to have a button for English, Spanish, and Creole, so that and like you said, in the back of taxis, and then they can kind of pick what they're interested in. And I've ridden in the back of the rides with patients a couple of times, and I see they're often not on their phones so much, and I feel like they're a captive audience. It's the perfect opportunity to say, hey, did you know you're at risk for this? When it comes to preeclampsia, Black women are really at risk, and we know that with Tori Bowie's death that highlighted that all over again. But if we can tell them that they're at risk for preeclampsia and tell them what to look at, don't disregard a headache, right upper quadrant pain, or things like that, swelling in your ankles. Contact your healthcare provider immediately. I think we can really save lives. And it's just like, it's endless, the educational opportunities that are there, like safe and affordable housing, weatherization services that are free or low cost. And Miami-Dade County has been really great in addressing heat health. And I think that's a great opportunity to tell these important patients about heat health awareness, but also a lot of their family members work in outdoor environments. And we're very good at telling our family members to remember to drink enough, or remember to stay in the shade, or just be on their case about their health. And so I think this is also an opportunity to not just touch these women, but their whole families in preventing heat related illnesses. So yeah, I love the way your mind is working, Lisa, and I really would welcome any kind of feedback now or in the future. Just send me a quick email, and I'd be so grateful.
My only comment is careful with the self-driving vehicles, that we're having issues with blocking emergency response vehicles out here in San Francisco. So,
oh, I haven't.
Yeah, we have electric self-driving vehicles that are more of a taxi service, and they're trying to decide whether they can utilize this as mostly a taxi service, but there's been issues with blocking access for emergency vehicles. So that's my only caution, is if there's one of those, well, they're sponsored by large, companies. And so that I could see as an opportunity for these companies as another way to, promote their industry within a community, is, oh, we have taxis, and we have part of it as being free or rideshare for, appointments. And I think it's yet to be seen about if this will be a sustainable or, a good opportunity to have, self-driving vehicles. But it's very early on in that realm for now.
Yeah, you never know where we're going to go, right?
Yeah.
But and also I just want to say, I hope this inspires you all to reach out in your communities, and maybe this will spark new ideas about how we can combine health for particular at-risk groups with climate action. And I think there are a lot of ways, and I would like to have more opportunities for sort of a more relaxed way to discuss that. And it's really good to do it sort of nationally, because you get input from your experience in California, which is different than the Midwest and in South Florida. So that's the way to spark a lot of conversation that can lead to really good solutions.
I also wonder if there's a way that the service could help take the load off emergency response vehicles. It's a challenge probably to serve all the 911 calls and have enough people to drive the ambulances as well. And if there's a non-emergency type of call, but people get to the hospital through 911 if they don't have a ride. So if there's a way to even expand that, that could be another opportunity.
Well, that reminds me, already with our pilot program, it's our clinic is not very far from the hospital. And sometimes the physician will want to send the patient into the hospital for additional testing or whatever. She can't be in active labor, of course, then you need an ambulance. But this is freeing up ambulances, because otherwise they would have to have an ambulance transport her, or also when they're ready to go home, if they've given birth, oftentimes, and I've heard this from many hospitals, the patients don't have a way to get home. So that's another area we'd like to expand in, is getting them home after they've given birth. And I think often it's a very economically, it's much more economic than you think. It boils down to about $25 a ride. And that, when you think of the missed appointments that cost about $250 an appointment, depending on what it is, it's a tenth of the cost, so, or a fifth of the cost. I don't know, my math isn't very good right now when you think there and back. But
one other thought is that I don't know if you have, if this is a national program or what, but I was just thinking about, the name of the program, and there is a interesting nonprofit that it's called 1-800-CARS for Kids with a K, and they take people's unwanted cars and then they turn it into, education or youth programs and things like that. So I wonder if there might be a partnership in the future for that as well.
actually, I think they're following us, or I would like to reach out to them because the name's so similar. I didn't realize that. And so, yeah, I think that would be a really fun collaboration. It's something else you said made me think of another thing that we're doing, but yeah, this is so great. Yeah, I think I will definitely reach out to them. I saw them, and yeah,
they've got a catchy tune, but they might be able to, they just take these cars off and donate it to families, and then or get the money to donate to their programs. So potential partnership. So exciting.
yeah. Oh, one more area of need that I've been approached a couple of times is foster care. Children in foster care. Many of the foster parents in the system are older women who either don't drive and or don't own a car. And so these foster children are not getting to dental appointments and medical appointments, which Kid One provides rides to dental appointments, which we will. But foster care really needs help getting their kids to healthcare.
Catherine, I know you started this pilot in Broward County. How is that? You launched this pilot program in Broward County. How is that going?
Pretty well. I have the statistics. So we started the very last day of May. So I have the statistics from the first month. And I don't want to tell you the wrong figures, but I was just looking at the printout. We serve about, and that's with the glitches and things that happened in the first week or so. We serve about 8 to 10 women a day. And so it's a lot, and we only have one car at this point. We're really looking for, or we're working hard on funding for the additional car because they'll overlap each other really well. But it just takes time, and we will get there. We're not giving up.
Have you approached any of these dealers, or because they all have to have some tax write-off? to maybe, donate a car, like, I know Subaru is getting involved with, some kind of an organization, so. Wonder
Yeah,
if,
they do. They often do. I reached out to a couple, but it's been a while. So now that we're up and running and serving families, then yeah, that's a great suggestion. You guys are wonderful.
right. So, so anyway, we're coming up to the hour. This is a great discussion, Catherine. We would like to have you back on to maybe, talk about the progress or how we can expand this nationwide, or, maybe somebody else would have some other, opportunity, because this is something that, working in the hospital system, we don't think about other aspects of how do people get to their appointments. So, but this is wonderful how we can collaborate and do this moving forward.
Yeah,
So,
I think, we work so hard every day with patients, but you really, on that pie chart, I'm a pie chart girl. When you really see how much of our health is determined by these factors, getting clinicians involved in addressing these social determinants of health, which you all are really doing that by addressing environmental issues, because it all comes down to who's most impacted by them. Then by addressing those, you're supercharging the work that you do in the clinic. So yeah, thank you so much for having me tonight, and I cheer you guys on. You're a wonderful group.
great. Thank you, Catherine. And if
Thank
those
you.
who are left behind to